if everyone has managed to take a seat. So welcome to the Whitworth Art Gallery, and a very warm welcome to everyone for joining us today, especially also those watching via the live stream or indeed the recording later on. I am Dr. Steve Hicks. I'm a senior lecturer in social work here at the university in the School of Health Sciences. But I'm also the research lead for creativity, health and wellbeing for Creative Manchester, and we are hosting the event today for you. So, as I've said, a very warm welcome to all of you from all of us. Just a couple of practicalities very quickly. We are live streaming today's event, as I've just said, so that does mean there will be a captioned version of the recording later on if anybody needs to make use of that. We do have a photographer present today at the event. You've all had a warning, as it were, about that. We aren't expecting a fire alarm, so if the fire alarm goes off, it's going to be real. So if the alarm goes off, just make your way to one of the exits. There are stewards around the hall. They're wearing purple tops. You can see some of them at the back. They will direct you to the nearest exit and also to the safe point for assembling outside. Just a couple of very quick words about Creative Manchester. As many of you probably already know, it's a university-wide platform bringing together researchers, academics, cultural and creative industry personnel across a number of key themes. As I've said, creativity, health and well-being is one of them, but also work around creative industries and civic futures and place making. And so we work with a number of partners and others across the city region and some from further afield as well. And many of you, of course, are here with us today. So we are committed to developing interdisciplinary work, perhaps developing creative methods as well, in order to allow researchers and external partners to work together in interesting or creative ways. Sometimes it can be difficult to bring people together across a very large city and also university, but bringing together people working on, for example, forms of creative participation, health economics, general practice or theatre or sociology or cultural institutions is part of what we are working towards or indeed doing on a number of projects. So that's why we're particularly delighted as Creative Manchester to be hosting today's event, which demonstrates some of the same ambitions, I think, to bring together people from all of those kind of different fields to work on health, social care and indeed social work issues, perhaps to reduce some of the inequalities that we see currently across the city region. So now I'm going to hand over to Made by Mortals, who are going to kick us off with the event.
Hi, afternoon everyone. My name's Andy Smith. I'm a composer and co-director of Made by Mortals, and we're delighted to be kicking off this afternoon with something creative. We're going to share with you Adam's story, or snippets of. It's an immersive multimedia production about a young person who's struggling with their mental health and transitioning from child to adult services. It's been co-produced by the Applied Research Collaboration and the Patient Safety Translational Research Centre, a team of professional artists, and most importantly, a group of amazing young people with experience of mental health illness who have shared their creativity and lived experience for the benefit of others. It's got a short promo film of the production.
Hidden Live, Adam's Story, is an immersive performance that challenges audiences to take a walk in the shoes of a young person struggling with their mental health.
You will be asked to put on the eye mask provided for you.
When you do this, you will enter an avatar and become Adam. Adam's life will become your responsibility. You will have the controls. You will have the headset.
Let's begin. Game loading.
Adam lives in a small family terrace in Greater Manchester with his mum, his sister and his grandparents. The home is busy, noisy, full of people. He hears everything: doors slamming, shouting, drilling from next door, a road outside, snatches of nature.
Try to drag yourself out of bed. Imagine picking up your toothbrush. Feel the weight of it.
Adam wants to be referred to adult services. Will they take him? Adam has just turned 18, and Sean, Adam's key worker, feels like a failure.
I probably shouldn't be telling you this, but I've always asked for forgiveness, not permission, me. Like when I first came to this job, I was told we don't do home visits. But I stood my ground and I did them anyway.
Choose the correct day of the week and tease out his pills.
You know you should take them with food, but Adam has no appetite.
You try to move Adam's body to the kitchen. A piece of toast, half a biscuit even. It's no use. You swallowed them dry.
Adam's mum is now even more in the dark.
And to be fair, they have a lot on their plate, especially since the pandemic. Lack of funds, lack of staff. As soon as you fill one vacancy, it creates a gap elsewhere, constantly robbing Peter to pay Paul.
Adam wants people to listen to him more. Only give him advice when he has asked for it. He needs people to lower their expectations of him, to know that he's not at his best right now. You look into the wardrobe mirror. For a brief moment, you catch a sight of Adam's skin. Face calm, mind screaming.
This multimedia theatre piece uses the imaginations and lived experience of real people and asks what you can do to help.
From his past that help Adam in difficult times. One of these items is a piece of music that was co-created and composed by the participants. But before we listen to the snippet, I just wanted to give you a brief window in how we approach that creativity with participants. First of all, you'll notice when you hear the track that it's got an eclectic mixture of musical instruments from around the world, reflecting the diverse heritage of the participants who co-created it. And also we wanted to, we've got the violin as the solo instrument, and the violin is Adam's voice. We wanted to portray that in the music. So how we created the actual dots, the music with the participants, some of whom had no musical experience, we asked them to imagine that their voice was Adam's voice. We listened to the audio that we created. One of the lines stuck out. It was, "What's wrong with you, Adam?" And when we asked the participants to imagine them being Adam and saying that sentence out loud to themselves, they had a go and it had a natural rhythm to it. "What's wrong with you, Adam?" So we started playing with that, and then we had a violinist come into our sessions, and we asked the participants to imagine again that they are Adam saying that sentence, "What's wrong with you, Adam?" And that had a natural intonation. Their voice had a natural intonation that could be transferred into a short musical motif or melody, like this. "What's wrong with you, Adam?" So when you listen to this snippet of audio, have a listen to that little motif. You'll hear it 4 times at the very end. That's Adam asking to himself, "What's wrong with you, Adam?"
Amongst the broken glass laser box.
It is Adam's grounding box.
Reach for it. Hold it tight.
The box is filled with precious things, things Adam holds dear. It is an old shoebox, simply decorated. Half the box is colourful, and half the box is sad looking, like Adam. On top of it, it says "Keep Out" in black letters. On the sides, his name is in bright colours.
Adam.
The box is filled with things that take him back, things that remind him of a time when he didn't have so many troubles on his shoulders.
Adam feels the need to make memories, to remind him of who he is, collect things that remind him that he is not just his illness.
He is these things. Things that are hopeful. Things that remind him that he has been well and that he can and will get better.
Take the things out.
Look at them one by one. Take them in.
Cards with quotes on, given to him by his friends and family.
Worry dolls.
His first ever game console, Nintendo DS.
Mario. Sam and him dedicated 2 whole months to completing it.
Sims. Games from a time when he remembers being in control of his world. Just him and himself and his games.
Certificates.
A scrapbook filled with tickets, receipts, and photos.
Of a family trip with his sister and mum to Cornwall.
A silver necklace. Him and Sam have one each. Only cheap. £2. They bought it from Amazon. They both bought it at the same time.
In the bottom of Adam's grounding box is a scratched vinyl. Adam places it on his father's record player, and it crackles as it starts to turn.
The music feels homemade. You can tell he likes it.
It is not immediately upbeat. It gradually moves with you, with Adam.
Music for now and where it all began.
Music from where he came from.
Music that speaks to him as he is. Music that speaks his original language.
Adam is now beside you in this room.
The music eases you both into feeling brighter.
Outside, a bleak grey Manchester sky with a tentative sun peeking on through. As the music plays, you watch Adam breathe and move.
As he inhales, he catches a familiar scent. His mother is cooking curry for the whole family for the first time in a long while.
They must have gotten home without you noticing, without Adam noticing. You watch a tear roll down Adam's cheek.
And as the music plays, the deafening sounds of Adam's life move into the background.
And when the music comes to an end, you will watch Adam stand on his own 2 feet. Comfortable, back in his skin. For now at least.
You will watch him head downstairs to join his sister, his grandparents, in his mum's arms.
Thank you very much to Made by Mortals. Okay, I'm Julie McCarthy and I am Strategic Lead for Creative Health for Greater Manchester Integrated Care. So I'm delighted and extremely proud to welcome you in person and online to the launch of the Greater Manchester Creative Health Strategy. 30 years ago, volunteering on a drama project in a high-security prison in Brazil, I had a moment of realisation of how important culture and creativity was to the lives of everyone. And I've been working on that idea ever since. So for me, this strategy is informed by community development practice in Brazil, health equalities work in China, the creative programme at 42nd Street in Manchester, drawing migrant birds with Chinese migrant women, and my own trajectory. The arts helped me find my own voice and my own path through the world, far away from that confused child with plenty of lived experience. And even now, I see how being able to express themselves creatively has been so important to people in my own family as they went on a long recovery from illness. These are the things that underpin my personal commitment to creative health. But of course, the strategy is also informed by many hours of research, conversation, collaboration with colleagues from Greater Manchester in health, social care, local government, the voluntary sector, as well as national partners including the NHS, the National Academy for Social Prescribing, the National Centre for Creative Health, Arts Council England, and of course the University of Manchester. And I'm pleased to announce that we've just been awarded £250,000 from the Arts and Humanities Research Council to help us as we put the scaffolding in place to support creative health practice. And Rebecca is going to say a little more about this later. This investment in Greater Manchester is an indicator of interest by research councils in our unique approach where creative health is fundamentally linked to addressing health inequities. And it consolidates our relationship with the University of Manchester as a research and innovation partner as we take this strategy forward. So today you're going to hear from some fantastic speakers, inspiring speakers, leaders and practitioners about the work that's happening in GM now and how we can build on this so that culture and creativity is at the heart of how we think about health, care and well-being. Right at the end of our event today, our resident poet, Ella Otomiwu, will be summing up what she's heard, and she's taking notes in the corner at the moment. I'd like to, with no further ado, I'd like to introduce Sir Richard Leese, Chair of Greater Manchester Integrated Care Board. This board oversees the new integrated care system which brings health and care together across the city region. Sir Richard is a long-term champion of the role of culture and creativity in the lives of the people of Greater Manchester. So thank you, Richard.
Thanks, Julie. Thanks for the introduction. Normally, if you're the last speaker, you have the problem that everybody's said what you're going to say. I think Julie's taken half my notes already, so as the very first speaker. But I really am pleased to be here for the launch of the Creative Health Strategy, an ambitious plan for Manchester. It's first strategy in the world, but it's for Manchester to become the first city region in the world to harness the power of creativity, culture and heritage to improve the health and well-being of our residents. Now, I have long been an advocate for the role of arts in our city. A number of reasons for that. First of all, it's a major employment sector, and let's be clear, work itself is a health outcome, and poor health is often the reason that many people, in fact most people that aren't able to work. It brings visitors to the city, and bring visitors to the city creates more jobs, more work, so add a bonus there. It supports the creativity and innovation we need to build a better, fairer future, and we are very much talking this week and every week, not just about building back better, but about building back fairer. It gives us quality of life, and as the Arts Council said in their 2018 report, Arts, Culture and Wellbeing, making and experiencing arts and culture transforms quality of life for individuals and communities. And quality of life is why people want to live in a particular place. And something you will hear a lot more about this afternoon from people who know a lot more about it than I do is that culture can have real therapeutic value as well. Probably ought to say a little word about the integrated Care Board, or to give it its full title, NHS Greater Manchester Integrated Care Board. No wonder everybody calls it the ICB. It's a lot easier than the mouthful. But it's the board I chair. It's only existed for 4 months. And it is part of a new integrated care system, bringing the NHS together with the 10 local authorities in Greater Manchester and other partners in a new statutory partnership. We clearly have had a devolution healthcare partnership for many years, but that's a voluntary partnership and had all the advantages and all the disadvantages of being a voluntary partnership. This is a statutory partnership. And we have a very clear but challenging remit. First of all, we do need excellence in clinical and care. We need value for money. We need to make sure people are seen in a timely way. We have to produce social value. We have to have regard for the broader economic and social role of the NHS in particular. We have to tackle health inequalities, and the last few years of COVID have really exposed, if we didn't know already, the very real health inequalities that exist, not just in this city region, but across the country, starting with deprivation, age, ethnicity, a whole range of factors that mean that we do not have health inequality here. And last but not least, we are supposed to tackle population health. Tackling population health, having a view about a broader approach, is not new. And indeed, I've got a quotation here from the World Health Organization's constitution from 1947, which makes it even older than me, which is that health is a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. And that's where we want to be as a city region. We're concerned, and this is actually, again, part of the statutory responsibility, no longer as a health service just with patients. We're concerned with people, all people. We're interested in people doing things for themselves, and a precursor to this strategy was a report, Social Glue, and in the introduction to A Social Glue, this is something I wrote in the introduction, A Social Glue makes a passionate and compelling case for the vital role of culture and creativity in achieving our aims of becoming a Marmot City region, where people can look after and improve their health and well-being and live in good health for longer. If people don't take responsibility for their own health, there's actually a limited amount about what we can do about that. But what we can do about that is about being collaborative. The new ICS moves the NHS from being a competitive system, which is quite bizarre, the notion of health being competitive, to a collaborative system where health providers are now legally obliged to work together, whereas previously they were legally obliged to compete with each other. A great step forward. But just occasionally we do need to do things to people. And the idea of a do-it-yourself hip operation doesn't really appeal to me very much, really. You do occasionally need some people with real expertise that do things to you, but obviously with your consent rather than without your consent. What role does culture play in this? And I think I've identified three areas, really. First of all, it can have generally a preventative role for all of us in improving our quality of life, improving our well-being. Hard to measure. It's one of the reasons why systems have never been that keen on prevention, is because you have to measure something not happening rather than something happening. But the preventative element is really, really important, and is important for all of us. It can have a broader preventative role for people who are at particular risk. And we saw throughout COVID where people were identified as being clinically vulnerable, about being able to take preventative action because we'd recognise that. But I've got an example which I think comes from Dance for Health, with a programme of fall reduction. Fall reduction is a real cause of death amongst older people. So fall reduction, dancing to reduce fall reduction, which apart from anything else makes having good health fun rather than a lot of things we feel obliged to do for our health can seem a bit of a chore at times. So actually culture can make good health fun. And of course, as I said earlier, it can have a therapeutic value. Social prescription now has become not an oddity, it's something that is talked about very, very broadly. There is an increasing body of research that supports social prescription, and particularly social prescription as an alternative to, I think it's about 50% of drug prescriptions actually don't work. So finding an alternative makes quite a lot of sense, really. And to be clear, although I think there is a lot of emphasis on the role of culture and arts in mental health, as from the example I gave about fall prevention, there are lots and lots of applications in physical health as well as mental health. I want to finish really by name-checking some of the things that are going on within the city region. Not all of them, there are far too many to go through all the things that are going on, but just to give an indication of the sorts of institutions that are involved and the sorts of practices that are taking place. People whose mission is to improve community and individual well-being through access to the arts and heritage. The Whitworth Art Gallery, where we are, it's probably been doing it for at least a decade, actually, being involved in this sort of work. Art with Heart in Salford. And as a former leader of Manchester City Council with a Greater Manchester role, I'm going to be very clear. I'm going to have examples from outside the city as well. ARC in Stockport and Bolton Octagon, other examples of where artistic excellence and a commitment to engagement and co-production come together to generate real impact and change for communities. We also have organisations that are true specialists in delivering arts-based health programmes. The Arts and Mental Health Service at I Thrive, working towards a GM-wide of arts-based mental health support for children and young people. Paul, working with people in recovery from substance misuse. And the Camerata. We've seen music in play already, but the Camerata supporting people with dementia through music in mind. There are many, many more examples, and I'm hoping with the support we're going to get for this programme, for this strategy, that over the next decade there will be many, many more to add to that list, and indeed a list long enough that we can spend the afternoon just reading out who is involved in using creative and cultural tools to improve our health and well-being. But I will finish with just saying this, and it says, we should be in no doubt that a culturally rich and creative city region is part of what is going to foster an overall healthier city region. Thanks very much.
Thank you very much, Sir Richard. Okay, I'd now like to move on to introducing Dr. Clive Parkinson. Apart from being a very, very good friend of this strategy and myself, so Clive is a leading thinker and practitioner in creative health. He's the author of A Social Glue, which paved the way for this strategy that we're launching today. He's also the instigator of the Manchester Institute for Arts, Health and Social Change, and we certainly would not be here today if it wasn't for him and his work. So over to you, Clive. Thank you.
Bloody hell. I've got a mask on, and should I take it off or should I leave it on? It's a really tricky one. People are saying leave it on. I'm looking to certain eyes, but I really want to take it off. I'm wasting my time, aren't I? I'll take it off for a little bit because we've got these machines here. See how I feel. I'm a vulnerable sort, so there's good reason for the mask. And it's the first time I've been in a crowd since 2019. I did a small crowd in a tent, but that's another story. All right, so I'm just going to crack on. A few years ago, a number of people across Greater Manchester contributed to a shared statement of passionate intent. published and launched as the Manchester Declaration at the World Healthcare Congress here in the city in 2019. This modest proposal, in part, celebrated the potency of culture in all its forms in the lives of people who contributed to it. It also had an explicit aspiration. By 2024, Greater Manchester will be the UK city region where heritage, culture and the arts play a key part in the health and well-being of its diverse residents and workforce. A global leader addressing systemic inequalities across the life course, demonstrating and nurturing the power of collective creative action for social change. It feels to me like we're on a journey that's embraced much of the passion set out in that declaration. And many of these ideas were elaborated on in a social glue, which Sir Richard Lees has alluded to. A social glue offered a platform from which to spearhead a change in creative health, from a situation in which arts and health is focused on ill health and deficit, to one in which human creativity is seen as a liberating social asset and a means of affecting individual and communal change. In a social glue, I set out 8 recommendations that look towards getting strategic leadership in the field, embedding creative approaches to health and well-being in policy, moving away from deficit-based medical models to social models, radically reimagining the evolution of high streets and galvanising diverse communities to be part of this social change, and building our identity as a creative health city region. In some ways, I actually think we're ahead of that 2024 aspiration. We're edging our ways there. All right, we might not have converted the streets into these dreamlike places of culture and bliss, but we're heading in the right direction. Last year, in their implementation guidance on how integrated care systems should work with people and communities, NHS England set out some key principles that echoed a social glue, putting the voices of people and communities, especially excluded groups and those affected by inequalities, at the centre of decision-making and governance, and starting those conversations early, not late in the day, and feeding back to people as they're going along on the journey. They talk about utilising community development approaches that empower people and communities making connections to social action through co-production, insight and engagement to redesign services and achieve accountable health and care services. And all of these ways of doing should be seamlessly connected to the creative health agenda. It's all implicitly tied up, or explicitly actually. Why the term creative health? I wasn't sure who the makeup of the room would be today. What about all these other words, the arts, heritage, culture? In truth, this is my interpretation, it's a neat catch-all. Something that's straightforward to grasp. It does what it says on the tin. It evolved through the All-Party Parliamentary Group on Arts, Health and Wellbeing in its 2017 report, Creative Health, alongside strategic developments of the National Centre for Creative Health and the sister organisation, the Culture, Health and Wellbeing Alliance. And across the university, I was about to say, across the universe, no, across the UK, not just England, the momentum for change is fast accelerating, and it is in Wales and the devolved governments. We're going to get some detail about the Greater Manchester Creative Health Strategy, which I'll just call a strategy from now on, from its author, Dr. Rebecca Gordon-Nesbitt, very soon. For a moment, I'd like to think about why we're here today and the distinctiveness of Greater Manchester, and how, with some confidence, we might all describe ourselves, every one of us in this room, as being the constituent parts of a creative health city region. In fact, the people are the city, its towns, its neighbourhoods, its streets. We are the people are the city. In our northern heartlands, we've often been described as the wellspring or crucible of the arts and health movement, and as far back as 1973, Peter Senior, who'd go on to instigate the organisation Arts for Health, was working as an artist at Withington Hospital. And in 1977, Hospital Arts was set up by Brian Chapman, This later became Lyme, the very organisation that's recently had its own Arts and Wellbeing Centre built just across the road from us today in the Oxford Road campus of the hospital, and whose award-winning work is becoming central to staff well-being, which I'd say at this time in our lives, we can't say post-pandemic because it really is here still. It's never been more critical. So hello, Dawn, and brilliant work. In fact, the first Arts on Prescription programme started in Stockport in 1994. Supporting people living with mild to moderate depression and postnatal depression. And organisations like START over in Salford have been doing this for years. They might not have called it social prescribing. It comes with all sorts of other things, but they've been doing it. And I think this is an incredibly rich base for Julie to build on. No pressure, Julie. But enough of the history. What about the here and now? Both the Social Glue and the strategy published today revel in the distinct flavours and nuances of the city region and its people. See, here we are, in present tense, for the launch of the strategy, a strategy that makes important distinctions between equality and equity in a world where there's no simple, level playing field for everybody to start their life from or to make changes, but where multiple challenges require the distribution of multiple resources across a sliding scale on the social gradient. I don't want to paraphrase Rebecca too much and her presentation, but these are really important words, important points that need amplifying, as is her well-researched reminder about how different inequalities interact with key socio-economic inequalities centred on housing and the lived environment, education and skills, power, voice and participation, and the list goes on. Creative health in all its guises has a significant part to play in addressing equality and equity. And for me, critically nurturing opportunities for people in all their beautiful diversity to grow their skills, their power, and their voices. But what a world we live in. Forgive me if I slump into some kind of reverie for a minute. It's difficult to stay with our dreams as a flourishing city region when not so very far away, cities, towns and streets are being pounded by bombs, anonymous lives are being squashed out, all our exaggerated and aggravated televised anxieties. Watching Boris Johnson swaggering around a great lump of vanity, like Donald Trump before him, and in some perverse way that silly but terribly dangerous man in Russia, were surrounded by maniacal arrogance, trussed-up little men in their ill-fitting suits, hell-bent on their own brand of self-serving publicity, deluded perhaps, but still with dangerous acolytes. What we've witnessed in national politics these last few months makes a mockery of every single one of us in this room, reduces us to bystanders at the very worst kind of circus or civil war. It shows us how we can behave. The elite few run it for the well-intentioned majority. It could be so easy to drown in that cumulative day-to-day reality of the cost of living crisis, the unfolding war, and all the while the environmental breakdown of the planet. Yes, reverie can be a dangerous thing, but it would be ridiculous not to acknowledge that what we do today is happening in a broader context and a larger and more toxic context. But if I close my eyes, it's very easy for me to revisit the people and places I've worked with and known over this last decade or so. The isolated woman in that badly cladded tower, hunkered down under blankets and coats, quietly voting for her favourite celebrity dancer, or else stifling a tear at the beauty of blue whales cutting through the chill Arctic waters as hypnotic slabs of neon ice, larger than skyscrapers, slip away into the warming sea. That woman is now redefined as a poet. The terrified lad with an invisible turmoil too bleak to recall, dragged away for his own good, formulas for well-evidenced medicine, took away the extremes and fears, and with time he inched away from the chemical numbness and imposed some order and pleasure on his body and mind through movement and dance. The lad, now a man, dances and sings and is a storyteller of beautiful dark places and of transformation. There was another man. These are very real people that I've smudged into something else. There was another man, a giant of a man, who experienced things I can't imagine. A veteran of conflicts of war in far-off places. But back here, he was out of joint, disconnected, at odds with the world. A wet day, another conference, he sought me out, waited patiently, his whole body shaking. We'd badge him up as PTSD, I reckon. See him once a month, send him on his way. But he'd heard one thing: the arts give voice. And through his voice, that man regained power. For my part, I hope that we never lose sight of the messy nature of human impulses to create, and that in doing so, we might begin to have impacts on things that, more than our own individual health, but the well-being of others and the environment. Those displays of the moral behaviour at Whitehall should only strengthen our resolve to do things differently. We should embrace something of the City of Salford's motto: let the welfare of the people be the highest law. A motto that provided the name Suprema Lex for their amazing creative arts strategy where people and place were central. Our history, tenacity and evolution allow us to stand apart, to distance ourselves from toxic national politics. Seriously, we're better than that. We aren't looking for and don't need permission from Whitehall to do the things the way we do the things we do. A few years ago, the chief executive of NHS England, Simon Stevens, was interested in how the health service might move beyond a purely biomedical model, placing prevention at its core to better realise, and I quote, I love this quote, to better realise the renewable energies of the community. I like this, renewable energies. Something that if we practice, just like our muscles, just like our brains, will get stronger and more powerful. Right in front of our eyes this last decade, different communities have increasingly become part of the very fabric of cultural institution. Just down the road, Manchester Museum isn't just opening up after a refurb. Its director, Esme Ward, who's here today, describes the curation of the new South Asia Gallery as being undertaken by ordinary folk. Not museum folk, just extraordinary, ordinary people. I love that. It is co-curation and lived experience on an epic scale. Its mission speaks volumes: to build understanding between cultures and a more sustainable world. We're driven by our values to be inclusive, imaginative, and caring. What a word. This is a living, breathing example of doing things differently. And our hosts, the Whitworth, as you've already mentioned, they've been doing the salutogenesis thing for years. It's a health-growing, health-promoting organisation. It does it as its bread and butter. And there are many small-scale projects across Greater Manchester that echo this beautifully. Over the last few years, I've personally described this thing that we're all here today to be part of as being at a time and place where stars align. Well, we are, and we're on the brink of something phenomenal. It's time to capitalise on it, but we need to keep our imaginations nurtured in the difficult times that we're in. We can't stick our heads in the sands over the bigger issues, but embed them in our thinking and exploration of ways to resolve pieces of a larger puzzle. I can hear music. In different but similarly difficult times, just after the Second World War, alongside the birth of the NHS and the welfare state, It was a significant time for culture and another birth, that of the Arts Council of Great Britain. In his 1952 book, In Place of Fear, architect of the NHS, Aneurin Bevan, held the view that artists of all types had a key role in contemporary society, and that someday we shall enfranchise artists by giving them our public buildings to work in. It's tiresome to listen to modern art critics bemoaning the passing of rich patrons as though this must mean the decline of art, whereas it could mean its emancipation if the artists were restored to their proper relationship with civic life. Bevan's wife, Jenny Lee, was the Minister for Arts and the driving force behind the UK's first cultural white paper in 1965. Through their shared vision for health services and culture in everybody's lives, Lee and Bevan perhaps help us make a link between creativity and health. Increasing government funding of the arts by 30%, Lee wanted the arts, like education, to be available to the many and not just the few, locally, regionally, nationally. In the introduction to her white paper, she stressed the importance of the sometimes indefinable role of artists and the need for the state to honour the complexity and sometimes provocative nature of the arts. Perhaps we're now at a place in Greater Manchester where we can embrace the creative health agenda and, like Bevan and Lee, in terribly difficult times, address the ingenuity gap that plagues health and social care. We're doing so much already, and from the cradle to the grave, there are ways in which human creativity offers thinking and doing things differently, mitigating against mental distress, enabling richer lives better lived in the most vulnerable people, and nurturing strong and powerful voices amongst the most marginalised citizens. Everything is set for the Greater Manchester Creative Health Strategy to be the touchstone for us to make creative health a defining feature of who we are, what we believe, and what we can achieve. And that's it. Thank you. Thank you. Thank you.
Thank you, Clive. Moving on. And now Dr. Rebecca Gordon-Nesbitt is going to introduce us to the Greater Manchester Creative Health Strategy. So Rebecca's the commissioned author of the strategy, and her insight, intelligence and patience have been so important in our work together over the last, I think it must be a year now, and we very much hope that this partnership will continue. Rebecca is also a research fellow at King's College London and was the lead researcher on the All-Party Parliamentary Group report on creative health in 2017. So I will hand you over to Rebecca to go through some aspects of the strategy.
Well, thank you all very much for coming. Good afternoon. I'd like to start by thanking everyone involved in organising this launch event and to all of you for coming. It's great to see so many people in one rather grand room, all passionate about creative health. I'm going to speak for no more than 15 minutes and then leave a bit of space for questions at the end in case anyone has anything pressing they want to ask about the strategy, and I'm going to attempt to go through some slides as well while I'm talking. Multitasking is always a challenge. I'm particularly grateful to Clive Parkinson, fantastic, what an act to follow, for recommending that I got involved in this in the first place, in progressing the vision that he presented in A Social Glue. I'm really honoured that you thought of me as the person that could take that to the next stage. And I'd also like to thank Julie for heeding Clive's recommendation and inviting me to write what became the strategy. Now, I say became because it didn't begin as a strategic plan. It actually started life as a delivery plan. But as we worked on it in discussion with our excellent advisory group, we realised that there was a missing link. What we needed to do was to have a look at the priorities that Greater Manchester had set for itself and think about how creative health could match up to those priorities. For me, the most exciting part of this work is something that we've touched on already today, discovering that the political will exists here to not just pay lip service to the idea of tackling inequities, but to actually do something about it. I was delighted to discover that Michael Marmot and his team had been here already, and the Institute of Health Equity team, and they'd already taken a deep dive into inequities in Greater Manchester, and also the Independent Inequalities Commission had recommended that GM focus on two things: equity and well-being. In fact, they called it equality, but I'm going to call it equity for today's purposes, for the reasons that Clive has already mentioned. And all of this is starting to pay off. Some of you in the room will have seen that the British Medical Journal included an article, I think it was last month, about the impact of GM's devolution on reducing inequality and inequity. So it's already starting to happen. And this is where creative health can really come into its own. And the strategy we're launching today shows how creativity, culture, and heritage can all help GM to become what it wants to be itself, which is a greener, fairer, more prosperous city region. In the process, the strategy also takes account of NHS England's priorities, including something called Core 20+5, which looks at how to tackle deprivation, marginalisation, and the 5 most pressing health conditions. So these are things that we touch on in this strategy and try to show how we can really contribute to this discussion. So we start at the very beginning, as Julie Andrews recommended. In the early years, when the citizens of tomorrow begin their journey in life, we know that children from more affluent families are exposed to 20,000 words per day than their poorer counterparts. And they benefit from creative, cultural and heritage opportunities that help them to develop emotionally, socially and cognitively. So it's no surprise that children arrive at school with great big differences in their abilities to learn, which compromises their educational progress and then in turn affects the kind of job that they can expect when they leave school, all of which, as we know, affects our health and well-being. But this isn't some kind of natural order. The ability to develop and to learn isn't innate. It's determined by our environment. And through creative health activities, organisations in GM are already helping children to prepare for learning and fulfil their potential. And it doesn't end there. The Be Well project in Greater Manchester schools and colleges promotes creative approaches to mental health and well-being, boosting resilience in children and young people. We've heard a bit about mental health already today. As we probably all know, mental health is unevenly distributed across the social gradient, whether that's anxiety, depression and stress that blights our lives, or more severe conditions like psychosis. So where you're born and where you grow up really affects your likelihood of developing some of these conditions. And of course, as we already know, there are some incredible artists and organisations working in the GM community to offer restorative creative health activities. As Clive mentioned, this is Start in Salford and they've been doing it for centuries. Each of these organisations and individuals is going to need support to be able to thrive and to inspire others across the city region as part of a preventative approach, which Sir Richard mentioned. During the pandemic, we've seen that people with long-term health conditions have been more susceptible to the virus. And because chronic conditions are more prevalent in poor and marginalised communities, COVID-19 has hit these communities the hardest, causing unnecessary deaths and a greater likelihood of developing long COVID. As an antidote, throughout the UK at the moment, we're seeing initiatives that offer singing to tackle the breathlessness that's associated with long COVID, and it's having very encouraging early results. Dementia is also unevenly distributed throughout society. People who live in deprived areas are more likely to experience an earlier onset of dementia and to die younger than those who live in more affluent areas. And some of this is quite extraordinary. I mean, I'm saying it as though it's very matter of fact, but literally the way you live your life and where you live determines your life chances. It never ceases to astonish me, and it's hard to just kind of reel off the facts without feeling something about it. We've established the disparities in all of these conditions, and if we think about dementia, there's some very exciting new research that's come out recently that shows exactly how this might work by looking at the way that we live our lives and how that influences our likelihood of developing dementia. And you can see that many of these factors are a product of deprivation and marginalisation. But So, for example, being depressed or socially isolated or sedentary can be risk factors for dementia, as can our old bugbear, less education. But the physical, social and mind-expanding properties of creative, cultural and heritage activities have a sizable part to play in keeping our brains healthy and redressing the balance. This is a dance activity, and closely connected to health, of course, is well-being. The two are really inextricably linked, and as we saw, well-being was one of the priorities of the Independent Inequalities Commission, so we're looking at both things at the same time. And creative health activities have been shown to make a big improvement to our well-being, especially as we age. And at all ages, creative health approaches can help to keep us living well at home rather than needing residential care, which is one of the priorities of adult social care here in GM. A key part of our consideration in writing the strategy has been the health and social care workforce and the tangible difference creative health can make to workplace well-being, which we'll be hearing more about from Dawn Prescott at Lyme. This is just some of just a very brief snapshot of some of the ways in which creative health will help GM to meet its objectives and to iron out some of the inequities that we talked about. The strategy identifies priorities across the life course, so in each kind of life course stage, we identify some of the activities that we think will make a really big difference in the short and medium term. So for children and young people, for example, we advocate, among other things, early years creative activity in the community, including nurseries, creative family activities at home to help people prepare their children for school, reading aloud to children in libraries to compensate for that huge gap in the number of words that children are exposed to, and creative, cultural and heritage activities being an integral part of social prescribing and mental health services. The strategy also looks at 6 areas of work aimed at the system change that will be needed for GM to become a creative health city region. So it's about how we knit together all this activity, which has been, to some extent, acting in a discrete way, in isolation from each other. So we need to kind of bring that together. And in order to do that, we need a sort of system change, essentially. The 6 areas of work are the visionary leadership, which you have in abundance here already. That's going to continue to be indispensable at a neighbourhood, locality and regional level. And the knowledge of where creative health's happening. So everyone involved, all of you in this room and all of your colleagues, is going to need to know where and how creative health works. In the first place, this is going to mean locating GM's creative health assets from excellent participatory arts organisations and libraries to world-class cultural venues and the built, natural and intangible heritage that makes up our local communities. We're also going to need to know how it works, so that's going to involve sharing evidence of what works in a format that's most useful to those who need it. And by knowing how creative health works and where appropriate activities can be found, health and care commissioners are going to be able to invest resources in approaches that will help to meet their priorities. As we've already heard, the creative health workforce is going to be crucial to all of this and will need to be trained and nurtured in art schools, medical schools and colleges offering social care courses. And finally, details of GM's identity and progress as a creative health city region are going to need to be shared locally, nationally and internationally. Most importantly, as Clive's already mentioned, in working to enhance equity and well-being, resources will have to be invested according to need. And this is a nice visual capture of the idea, the difference between equality and equity. Equality assumes that everybody's working on a level playing field, whereas equity acknowledges that greater help is going to be needed by those with greater challenges to face. By becoming a creative health city region, GM's going to save money in health and social care and generate a social return on investment. By putting resources into activities that enhance lives, GM will ensure that the people who live and work here will be supported to live longer, healthier, happier lives. And by actively tackling the social determinants of health through creativity, culture and heritage, these benefits will be more equitably distributed across the city region. The commitment to making this a reality, as we've already heard, exists among those people working hard to integrate health and social care. The immediate next steps are going to be that a delivery plan is developed to translate this strategy into action. And later this afternoon, I think Julie's going to make a few pointers about what this entails and how we're going to bring that into life. In addition to the delivery plan, as Julie's already mentioned, a team led by the University of Manchester has recently secured a significant amount of funding from the Arts and Humanities Research Council. And what we're going to do with that is build a creative health consortium made up of a diverse group of individuals and organisations representing communities, cultural organisations, arts charities, health and social care providers and local government. And this consortium, or coalition as we like to call it, is going to begin to map creative health active assets and look at their distribution in different localities. So we're hoping to generate some sort of heat map where we can see where the areas of deprivation are and look at perhaps whether they correlate with creative health deprivation as well and how we can try and fill those gaps. We're going to work together to understand how we can use those community assets to improve health and well-being and increase equity. We want to know which assets people use and what the barriers there are to using them. And as I've said, we want to know where the gaps are as a sort of precursor to finding out what we can do in people's neighbourhoods. And we'll be asking clinicians and commissioners what kind of evidence they need to see to persuade them to embrace creative health approaches. Okay, so that's the sort of where we are right this second, right now, and what we're about to do. And I'd just like to finish by putting GM's work in a national and international context. And you'll notice I've rather cheekily come up here and from outside the region, city region, and have put my particular spin on this strategy. But it also means that with a bit of cheek, I can get away with telling you just how lucky you are and what you need to do and how important this work is. Because coming from the outside, I can absolutely see what you've got here, and it's such a fantastic resource. So it can't have escaped anyone's notice that the country's going through a bit of a difficult time at the moment, and Clive very articulately outlined what I meant by that euphemism. So aside from the pandemic, we've had to cope with the effects of austerity, Brexit, rising prices and collapsing social support. By contrast, GM is an absolute oasis of social justice, a city region committed to improving the lives of everyone who lives and works here. How amazing. Creative health has existed as a phrase, as we heard from Clive, since 2017, but the work behind it has been going on for decades. You've already mentioned so much of this, from the early hospital exhibitions in the 1970s to the pioneering arts on prescription activities in the 1990s. GM really can lay claim to being the birthplace of this movement. And this is a slide from Langley Brown, who was very much involved in Arts for Health and Lyme and START, in fact, the initial incarnation of START. A real spaghetti of activity dating back to the 1970s. There's a copy of this in this strategy, so you don't need to strain your eyes looking at it too closely just now. But it really shows how GM is a nexus of creative health activity. So it makes total sense, really, for GM to become the world's first, let's say that again, the world's first creative health city region. What you're doing here is pioneering. You're leading the way. And people around the country and around the world are going to be following your progress with great interest. Again, no pressure. But I know from my experience of everything that's going on and everything that will go on here that you'll rise to the challenge. And I wish you every success in your endeavours. Thank you very much. Thank you. And I'm going to stay up here just for a few minutes if people can tolerate that, just in case you have any pressing questions about the strategy. You probably haven't had a chance to digest it just yet, but there's a little flavour of it there. So are there any questions that spring to mind? No, wow. I must have done my job well explaining. Nope. Okay, we'll make up a bit of time then. Great. Thank you.
Thank you ever so much, Rebecca. I'm sure there are lots of questions, but people have only just got it. So in fact, we only just got it yesterday, the finished printed article. So it still smells like freshly printed material. We're gonna have a panel, and then we're gonna have a short break for coffee, a comfort break. And thank you so much, Rebecca, for all your hard work and for that really great presentation. So we're going to now hear from a panel about why creative health is key to reducing health inequities in Greater Manchester. So we're going to hear from some health and social care experts. So if I could invite the panel members to come up, and I'll just introduce you as you're moving around. So we've got, the chair is Dr. Joeida Idu. She's the clinical lead for person-centred approaches at NHS GM Integrated Care, and she's the one of the clinical sponsors for the strategy, and she's also the chair of Viaduct Care. I have no idea where she gets the time. We've got Dr. Muna Abdelaziz. She's the director of public health for Salford Council, and she's also our public health sponsor for Creative Health. And we have Sandeep Renaut, so Professor Sandeep Renaut, Executive Lead for Mental Health for NHS GM Integrated Care. And is Steph not with us? Stephanie was supposed to be cutting a cab from another event, so where I think she was speaking at, she was being bussed around. So we'll just have to do that. But Steph was going to give us, we've had some really fantastic conversations with adult social care about how creative health can support people to live well at home. That it's not just about dementia, it's about all adults, all types of conditions, all types of circumstances, but we explore that in the strategy. So I will leave it to you three then. Thank you very much.
Thank you. Well, good afternoon, everyone. Isn't it wonderful to see so many of you here? I feel absolutely honoured and privileged that we're part of the launch of our Creative Health City region for Manchester, and the first in the world. It's just incredible. I'm here with some really great colleagues, and what we'll do is we'll sort of ask our colleagues to talk for about 5 minutes, perhaps a little bit longer since Steph's not here, so we have got a little bit more time to talk about from their lens and their experience how they feel creative health has impacted or can impact on health inequalities. And once Sandy and Muna have spoken, I'll give you a bit of a GP perspective and why I'm so passionate being the personalised care clinical champion for Greater Manchester and a GP, but I've got a few other hats which Julie I know has mentioned. I'm very proud to have been born in Old Trafford in the first NHS hospital. I'm a proud Mancunian, and for those of you who like United, I'm sorry, I'm a City supporter. But anyway, I knew I was going to get something like that. So I'm going to ask Sandeep, Professor Sandeep Renaut, our medical exec lead, and she's also a keen sponsor of our strategy.
Thank you so much, Joeida. And good afternoon to everybody. Julie, I feel hugely honoured to be with you today and to be part of this panel. Really, really do, because it's been a long journey for me in advocating and supporting creative arts and their role in health. And I've often been accused of being fluffy at many of my professional events. And so today is huge. It really is. So just to put it in context, I'm Sandy, Lou's the professor. We're all people. And I'm here for 3 reasons, I think. The official reason is that up here as the executive medical lead for mental health for NHS Greater Manchester Integrated Care. God. But also as still a practicing paediatric psychiatrist, and so that 1 day a week is so important to me, working with young people and their families, and they're the people who inspire me still to this day. And the day that I don't get inspired is the day I should retire. My kids say I should retire now, but anyway. That's the most inspiring day of my week. But I think most importantly, I'm here as a citizen of Greater Manchester and as a parent of 3. I like to still say boys because I still think I'm 23, but you know, they're young men now. I was also born on the east of the city in the Royal Oldham Hospital, where, you know, another firsts, the first in vitro fertilization, the first of lots of things. And I've been working on all the way on the west of the city, in the Wigan and Bolton areas, clinically, having trained somewhere in the middle of Greater Manchester, and also having had the opportunity to go and spend time internationally and in other parts of our country, but to come back again. I've always chosen to come back to Greater Manchester, and I make no apologies of that. I'm so proud to be a Mancunian. So that's kind of why I think I'm here. But specifically around creative health, you know, and its role in arts. Ancient philosophers, poets, and modern-day princes have reminded us that the greatest wealth is our health. And it really, truly is. But it's not health in the traditional way that many people think of health in terms of treating ill health. It's whole health and well-being. And whole health and well-being needs to be a whole health and well-being approach by all of us, for whole people, for whole communities, for whole, you know, systems. So that's why I'm a huge advocate of the role creative arts in its broadest sense has to play, all the way from prevention through to prescription. So that's my strapline, prevention to prescription. So it is prevention, but it's also about assessment, engagement, treatment, recovery. And for me, I make, again, no apologies, my bias will be mental health for the future of my work in Greater Manchester. You know, there's no health without our mental health and well-being. And creative arts has a huge part to play. We're doing lots already, and Greater Manchester has been doing lots already. But Julie and others in the team, this creative health strategy is a real opportunity to build on those strengths and to do something really radically different. Really radically different. And people have said it already before in the brilliant presentations from Richard and Clive and from Rebecca, absolutely brilliant, that, you know, that whole, we've got an opportunity in the Integrated Care Partnership now to actually embed this creative health strategy in the work that we do across health and social care, and it hasn't properly been embedded before. We've had some great work happening, but this is a real opportunity to do that, both in practice, and you're going to hear from some great practitioners after us, both in our practice and in our research and evaluation, but actually before that, I think Rebecca mentioned it, in our training curriculums. So in the way in which we train our future health and care delivery workforce, as well as the broader assets that exist in our communities. I know I had a really stressful morning this morning, and within 10 minutes of walking into this unbelievable environment, I studied down the road and we used to come to the Whitworth Art Gallery, that I was already feeling calmer within 10 minutes, probably not even 10 minutes, maybe less. No medication can do that. But this environment always does it for me. And it's why I'm a trustee at some fantastic organisations that are here in this room, the Castlefield Gallery, the Sick Festival, amongst many others who are already doing all of this work. But we need to connect it better and do it together, and this is our opportunity. So I feel also very privileged, Joida, to continue this work with you all and contribute. And just kind of lastly, I suppose, we've done bits and pieces. There is a massively growing evidence base for this and the power of creative arts in improving our health and well-being in its entirety, not just mental health, but long-term conditions and beyond, and preventing us from having long-term chronic illnesses. So there's so much work to be done, but lots to build on. That's fantastic. And we do need data. The power of story is really important. Stories will always trump facts, but the two together is what we need to really embed and influence strategy. And there are many people that can do that with you, Julie, and others, you know, and that's what, that's my offer, is absolutely to do that with you. People have talked about mental health being the pandemic after the pandemic. It's here, we've had rising demand year on year, and for me it's about the communities we serve in terms of mental health care for the future, but actually also our workforce, and that's been mentioned already. We've never had a more critical time for our health and social care workforce, who are burnt out, who have been working tirelessly. The two top reasons for sickness absence at the moment are mental health and related and musculoskeletal conditions, both of which this has huge power, and Joida will tell you much more than I can in that. So we have huge vacancies and we've got a huge gap there. Greater Manchester has been a city of firsts for so many things. So I can't think of a better city region in the whole world to launch this strategy. It pioneered our industrial revolution. So Joida, I think it's time to pioneer the creative health evolution. So I'll hand over to you.
Thank you, Sandeep. That's absolutely fantastic. And we could really sense the passion. And it must be because we're Mancunian girls. What do you think? I think so.
It is, but I've got a confession.
What?
I'm an ardent LFC supporter.
Oh, and I liked her before. But joking aside, that passion is what's needed. And as clinicians, we know trying to persuade our clinical colleagues is absolutely paramount, and our commissioning colleagues, because they will always say, what's the evidence? We understand drugs, we understand drug trials, but do we really understand the impact that creativity, culture and heritage activities can have? And I think we will be pivotal in making that happen in GM, won't we? So we're looking forward to that and having that challenge. But now I'm going to hand you over to Muna, who is the Director of Public Health from Salford Council and the Director of Public Health sponsor for our city region. So I'm excited to actually meet you because it's the first time I've met you. So yes, I'll hand over to yourself.
Thank you very much, and I'm really pleased to be here and pleased to be meeting you all in person after several, screen Teams meetings that have been going on. I'm really pleased to represent the Directors of Public Health in the 10 areas, and I know that in each of the 10 areas we are building on a strong heritage around culture, arts, learning, and diversity in our communities. And we want to capture that in terms of looking at the assets and building on what we do have and an evolution, as Sandeep has just said. So traditionally, we take a life course approach where we look at, starting well, living well, aging well, and then we kind of like discovered healthy places. But when we take a look at population health, we can segment it in different ways. We can talk about mental health, as we've just done. We can talk about sexual health. We can talk about financial health. And now we're talking about creative health. So how can we make a difference and make sure that this is a new and different conversation? Because we know that with new and different conversations, you end up somewhere you've never been before. So I want to expand on 3 of the issues that Rebecca touched upon in terms of underpinning this strategy. And I want to touch upon knowledge, evidence, and workforce development, because I think that those will help us and be key to reducing health inequalities in Greater Manchester. So first, knowledge. And it is, as a strategy, we want to facilitate access to information about the creative health assets, methodologies, and practice. But we know that this knowledge isn't distributed fairly. And we want to build on the assets. We also know that there are people who don't use our services. Maybe they don't want to use our services, or maybe they are tapping into some of the rich assets that they have and they don't really need the service that we are offering. So in Salford and other areas have coined their own terms. We talk about the missing 20%. When you do a job 80% good enough, it's the 20% we're all missing. So who are they? Who are they in terms of creative health? And in mapping the assets, we're not talking about physical assets. We're talking about social value, social capital. We're talking about culture, diversity. So this tapestry is rich in Greater Manchester, and we can build on that. We also can build on the partnership working that we already know we have. And education have beat us in health in terms of partnering with culture. We know we've got these local culture education partnerships. And now here we are wanting to set up a local culture health partnership. So what does it mean? What can culture give to health, and what can health give to culture? So that's a question that I will kind of like look at, how we can draw the evidence and maybe do some new interventions at scale across the whole of Greater Manchester. So the evidence that we are seeking is how can we measure health and well-being from our culture activities? We know we've got the 5 ways to well-being. We know that we can offer a health outcome framework for culture and creativity. When you try and measure apples and oranges and pears and they don't add up. But if you measure well-being, then you can see the well-being effect of an apple and the well-being effect of a pear. So I think that the richness of culture can be measured, attempt to be measured in well-being terms. And we know that culture brings a lot to health, because we did talk about mental health. We also need to talk about the strength of the sector in culture, hospitality, and entertainment. Jobs mean good health. Good jobs, meaningful employment, means good health as well. So something new we need to do is we need to grow our creative sector in the 10 areas of Greater Manchester. We have to grow those supply chains. The anchor organizations are doing grand. They recognize their supply chains, but the problem is that people don't know that they could become a supply chain, and that they do have a talent and they do have a richness that they could bottom and they could contribute. So I think that workforce development in the creative industries is a task for health now, because there's the talent, and we heard earlier, you can find talent where you least expect it. And that simply is because each one of us is talented and unique in their own way. So we can build on that, and we can develop a local culture and health partnership. And we can measure it in new health and well-being terms. But I go back to how can we change behavior? And there is a model that I'm tend to always use. And it is, if you want to change behavior, you have to make it easy, attractive, and social, and timely, be at the right time. That's culture, isn't it? Culture is easy, attractive, and social. So I think that is the midpoint. I think that is the center point of how culture can help health. Thank you.
Thank you, Muna. That's a really helpful perspective for us as clinicians, but also I think for those who are non-clinicians in the audience, because we know that we can embed these things, but we've actually got to make sure we create the conditions, and creating the conditions are what's going to really enable us to do that. So I'm going to give you a little bit about a GP perspective, and then we'll open up to some questions. So I work at the Alvanley practice in Stockport, and I've been a GP there for more than 20 years. And what I've seen in the last 23, 24 years is a growing level of poverty. And poverty, as we know, those broader social determinants, totally impacts on health. Poverty, worklessness, children struggling with their educational attainment, behavioural problems with children because parents are emotionally struggling, a lack of resilience, and all of it comes through my front door. And often we will see patients in our practices who don't have a medical need, but the consequences of what they're presenting with is those health social determinants. And so a few years ago, maybe it might be 4 or 5 years ago now, we started to work with our patients, and we would often see our patients in a deficit way. I think Clive used the word deficit. So what's wrong with you? And we changed that to what's strong with you, because we started to focus on what matters to people, and starting to realise that if we can identify a way to support them with that non-medical social need, then they are less likely to have that reliance on general practice, less likely to have that reliance on hospital. So we started with our 18 volunteers, all of whom had quite severe long-term conditions, lung conditions. One had breast cancer, another chap had lost his wife to leukemia, and I had only ever seen them in terms of optimizing their medical treatment and medical care. But that wasn't enough to really make the difference. The difference is when they started to say to me, I can sing, I can play the guitar, I can play a keyboard, I love growing my vegetables, and I love cooking them. My wife loves to cook whatever I grow. And they together co-produced their own well-being prescription, because they are the community, they are the people who live in that neighbourhood. And I really realised then that actually my practice of 6,000 people is actually a community anchor. And although we talk about big institutions being community anchors, we have 400 in Greater Manchester, 400 practices. And what we can do to make a difference is phenomenal. And those singing groups that we started to signpost our patients to, and this predates social prescribing link workers, but the link workers that have come have really enhanced that, have really enhanced the mapping of that. We worked with our local VCSE cafe, It's called Start Point. They had lots to offer, and they were funded by our local council. I can see a colleague there who I know has been pivotal and a great support to us, Chris. Singing Group was allowed to go there, and what that meant from an SME perspective, a small medium enterprise, is that people would go and buy a coffee. So we were helping to sustain the local business as well as supporting patients who went there. And I can see my colleague there, Jackie from ARC. ARC since, 1994, I think, Clive said, and I started as a GP in 1996. So I've had the benefit of being able to signpost my patients to ARC, particularly those who've had postnatal depression, who had mental illnesses, and it absolutely enhances the recovery of those people. So there is a place for medicine. There's always going to be a place for giving optimizing treatments. But when you actually treat this offer, the creative health offer, the heritage offer, the cultural offer, as importantly as you do the medical offer, you actually create something that allows a person to be treated as a whole. And for me, that's what personalised care is. It's what matters to you. And the last example I'm going to give you is one of our patients, David, who we put on what's called a gold standard framework, which means we anticipated he would die within a year because the level of severity of his lung condition was so severe, and he had optimised, he'd done pulmonary rehab, he was on the best inhalers, he'd had everything he possibly can have, and he stopped smoking. But we still saw that deterioration in his lung health. But once he started with the Singing Group, he started to walk better, he built his lung capacity, it expanded, the muscles in his chest got stronger, so again he could lift his rib cage up better. It's 5 years, and he's still here, and he's still walking, and he runs the allotment, and he loves being there because he connects with people, and we know social isolation has a huge impact. So I would really want you to sort of see that. It's given me a new injection. People notice I didn't have wrinkles today. I think I'm regressing because of the benefit and pleasure you get from doing this. And I really hope it will inspire others and other GPs in our community. And there is that community anchor bit because we also have apprentices, which Chris has helped us with. So our apprentice is a care leaver, isn't she? And she just passed her GCSE in maths and is starting to train as a healthcare assistant. Our previous one graduated this summer as a nurse from John Moores University. So being a community anchor isn't just about medicine, it's how we support people in our own community up that social mobility. And I just think there's so much we have to offer and so much we can contribute. So I'm going to now open up the floor. I think Sandeep's got a few comments she wants to make.
Just because Joida made me think, and something, Rebecca, you said in your presentation, I think the point that Joida made about changing the narrative is really important, and that's part of some of the work we've been doing, changing it from how we were traditionally trained, what's the matter with you, to what matters to you, is some of the work we're doing with foundation year doctors, for instance, and student nurses. And that's really key, that shifting the culture, changing the narrative of how people approach health and well-being and care in its broadest sense. So that was one thing. The other thing that you've made me think, Rebecca, as well, which is great because you're energizing us, the difference that all aspects of creative health make. So you mentioned books and that life course. One of the things that struck me in the Mentally Healthy Schools program that we did and have done and continue to do is that how much has been stripped out of our schools in terms of the arts curriculum, and how much that, you know, teachers didn't want this, they don't want this, they're struggling, and how together we could make that difference because we can support that because of the power of don't strip the creative arts away from our young people's educational environments. There's that, and then books. I think in September of this year, all over the media, articles that only one in five of our UK kids own a book now. That's not acceptable in terms of the power of what actually holding, feeling, looking at, a book and learning from that. And that doesn't mean digital books don't have a role, but that to me was astounding. So I'm going to stop there because you've made me think about how Clive talked about social glue, and that this really is the social glue, the creative health strategy.
Okay, so I think the juices are flowing, aren't they? We're all going to go and sort of get together and write a lot of things, but I would like to give the audience an opportunity to ask some questions, make some comments, and if you put your hand up, please wait for a microphone to come to you so that our colleagues who are online will be able to hear everything. So we've got a hand up there, please. I feel like Fiona Bruce. Question down.
Thank you all so much. It's so energising to hear the call for social justice, the challenge of inequalities. Fantastic. I just wanted to think a little bit about the asymmetry across the sectors and for us to have this asset-based approach to what's next. So within the cultural heritage sector, there's a great deal of precarity for the workforce. There are challenges around career progression. There are challenges around budgets. And I'm really interested what top tips you might have in how we negotiate with commissioners, how we work together, often the timescales that are required for really good reasons in the longitudinal effect of engaging with culture and heritage doesn't fit with the project context. So I'd really welcome any expertise you have in helping us work together in the commissioning process ahead. I realise I'm jumping ahead to the delivery plan, but it's so great to have this opportunity to think together. Thank you.
So, okay, so I suppose the thing that I would mention is that the creative health strategy is part of the Live Well strategy, and in Greater Manchester we are working with the VCSE sector, and Julie knows a lot more about this, but you're absolutely right. It's no point for us as clinicians referring to activities if the activities aren't there. We've got to have those destination activities, and we've got to ensure that the commissioning intent and approach, and we do have a VCSE accord and a commissioning framework, but that has to be the same as the way we commission other services. So we want to move away from that one-off, here's a bit of money for a few months. What we want to do is say, we know this works. We want you to be part of that clinical pathway, personalised plan for that patient, and that funding is the same way that we would fund a health provision. So a 3-year contract would be my dream for us to try and achieve. And I think there are people who see this, who recognise it, and who are absolutely passionate about making it happen. But I'm sure Sandeep might have more to offer.
No, just to strengthen and add to that, and hopefully to kind of give you some reassurance or assurance, I think we have the best opportunity we've ever had with the Integrated Care Partnership and the vehicle of this creative health strategy, so that what we're supposed to be now seeing in an integrated care system is the removal of commissioner-provider barrier, so that actually it's not going to work in the way that it has historically, that we will be able to inform that commissioning intent. There won't be that barrier. And actually what Joeda's saying is we need to work together as a whole system in actually, so it shouldn't be that we're referring to you. Actually, we should be part of one pathway of care. And part of that is the offer that is from whichever creative health organisation you are, and that it's embedded and truly integrated as part of the model that is commissioned in its entirety, if that makes sense. So I know that that's simplistic, but I like to keep things simple. And the Integrated Care Partnership, where you've got people like Richard Leese, who is chairing the Integrated Care Board and will be part of the Integrated Care Partnership through this vehicle, Julie, no pressure, is our opportunity. And you absolutely have the full support of people like ourselves.
So I'm just conscious of time. Have I got... Because we... Yeah, could we have one more question? There's a lady who's got a hand up there. He's just bringing the microphone over to you.
Hi, thank you. Firstly, I just want to acknowledge the fact that, Julie, Richard, Clive, Rebecca, it's been absolutely energizing and fantastic, and I'm loving the energy in the room. And also, I want to acknowledge the 3 panel powerhouse women that are there. That's really inspiring. I just wanted to, it was an observation regarding the dementia slide, and we know that certain communities are higher risk than others. As someone who has 10 family members and community friends who live with dementia, I see that within social prescribing, I'm a big supporter of social prescribing. I think it's fantastic, but across the region, there's gaps in social prescribing. So on the face of it, the social prescription, fantastic idea, I love it, but there's gaps in areas across the region. How are we going to fulfill those gaps? And also carers, have they been acknowledged? Because we've got a shortfall in a shortage in workforce within the social care. You've got carers who are working and unpaid carers who are taking time off work to care for their elderly relatives, to look after their children and their mental health. And are we addressing that crisis which is looming? It was basically how are we going to address the social prescribing gaps, and also with regards to dementia. Supporting those living with dementia to live well. As a dementia champion, in my local community, I don't see any culturally appropriate dementia care services. And, even most established age-related organisations, they don't cater for culturally appropriate needs. Obviously, great work being done by Hayley Lever, GM Moving. It crosses all cultural barriers, etc. But yeah, there are loads of gaps, and I know it's delivery, but I just thought I'd share that. Thank you.
I think Muna, you want to...
So thank you, and I think that's a really, really good question, and also links to the question before it about how do we make sure that the cultural sector grows and thrives and is there for us to refer into or for us to partner with. So take that in the context that what this creative health strategy is trying to do is to put in a program approach at scale across the whole of Greater Manchester, to be able to do things together, to be able to draw in funding, external funding, as we also just heard, to bring in a little bit more sustainability. We can do this grassroots as well as program level. Grassroots, what that means is we have to start to nurture those social enterprise cooperatives to bring them out in terms of their visibility, the fact that they are there, they are being used, and through that I think people will find a connection. Carers will be able to connect with each other because there's that creative offer in that local neighbourhood. So I think we ought to work at it both ways, from the programme approach through the strategy, through commissioning, as was also said earlier, but also grassroots. Where we have gaps, there's probably a richness that's able to fill that gap. Let's pool that resource and bid, apply, start to volunteer a little bit more, bring all of that richness to the surface, because we know that the richness of diversity exists. The problem we're trying to solve, the solutions are within the same communities. I think that's probably where I would take it. Thank you.
Thank you for that, Moon. And I can see Julie is really keen for me to finish, but I may come and talk to you at that coffee break. We just love the stage, don't we? We just love it. Anyway, thank you very much. It's been a privilege to talk to you, and we're here for the day, I'm certainly here for the day, so come and talk to us at the coffee break if you've got anything else that comes to mind. Thank you.
Frantic texts from Steph saying, we've had a transport disaster. I don't know what it is, but they're all safe, but they couldn't make it here. So we're going to have a 15-minute coffee break now. We're running slightly late, but I think we'll be okay. So we're going to reconvene back here at 4 o'clock, and we're going to hear from a great practitioner panel, and also Hayley Lever from GM Moving, who's going to talk about how we can work more closely with that sector and learn some of the lessons from the work they've done. Thank you. you want to say something? Sorry.
Yeah, I just come to pass a message on for Shani.
All right.
Yeah, she's trying to get here for the last part
Oh,
of it.
oh, okay.
She's been in Birmingham today.
Oh,
and
yeah,
then in
yeah, she
Birmingham.
told me. Is she still trying to get there?
She's going to try.
Okay, thank you.
But it's just wanting me to pass it.
Again, please. We need to start again to get all the amazing stuff we've still got to do. Yeah. I'll give them 1 minute. I'll give them 1 minute and then I'll... Can I ask you all to take your seats, please? That was a bit more, wasn't it? Yeah. Yeah. Brilliant. Are you enjoying it? No. I am. Yeah. When people like try to speak, I was like, oh my God. It's like no, I think my drama behaving themselves. Yes. Is it you first? Is it you first? It's you now, isn't it? Oh, we've been all quiet. That's nice. After we finish in here, there is a chance to pop downstairs, have some refreshments and a chat. So I would very warmly invite you to do that. There's cake as well. All right, thank you, everyone. We are running a teensy bit behind schedule, but that's the way with these things. And there's been such amazing conversations that I've been having in the break. We're now going to hear from Hayley Lever. Hayley Lever is the CEO of Greater Sport and the executive lead for GM Moving. And Hayley's driven, it says so on your blog, by a huge belief in the role physical activity plays in our health, wellness and happiness. And she has been and will continue to be an important ally as we take the Greater Manchester Creative Health City region forward. So she's going to talk to us a little bit about how we can work together, how we are really a seamless whole, I think. So I'll pass on to you.
Thank you, Julie. Julie's enjoying herself now. She's just confessed. So give her a round of applause. She wasn't quite sure she was going to, I think, and I know that feeling really, really well. So it's just brilliant to be here. It's tempting to go off track now and talk about all sorts of things based on what people have said earlier on. But I'm going to stick to my task and my brief. And Julie had asked me to come and share some of the learning from GM Moving over the years. And absolutely, we're here, everybody working around the agenda of physical activity, movement and sport, here as allies to this strategy, because it's fantastic. And so I'm here really because creative lives and active lives are absolutely like that, aren't they? They're like this. They're not like this. They're not in two separate silos or agendas or strategies. They're completely interwoven, and that's coming all the way through what everyone's said so far. And both the GM Moving strategy and the Creative Health strategy support Good Lives for All, which is our collective mission across Greater Manchester for health creation and addressing inequalities. So we're still really early on in the journey of GM Moving. We had a blueprint for change in 2015, GM Moving strategy 2017, which we refreshed GM Moving in Action 2021. So we're not really that far down the road compared to where you've gone with the social glue and this strategy. But we have had joy and pain and barriers and blockages and all sorts of things that are enabling change to happen and a movement to grow. And we're really well in, all of us working in this room on GM Moving and Creative Health together to be really honest about those struggles and joys along the way so that we can all learn together. And I've already learned from what I've heard here this afternoon. So I'm going to share some learnings and we're going to then continue to explore what's the relationship between GM Moving and Creative Health. And also to share some thoughts about how you grow real collective leadership and distributed leadership and participation in these kinds of strategies, because I think it was about 6 or 12 months ago Julie said to me, how do we do this? You know, we haven't got a big team, we haven't got a whole load of people to really kind of drive this forward, and actually that can be the power of it, I think. So so there's some learning in that too. As people were just so enjoying talking, I wanted to give you 2 minutes more to really kind of tune in to what we've heard this afternoon. So you've got 1 minute each just to talk to the person next to you on these questions. So how does creative health matter to you or your family, community or your work? And how does moving matter to you, your family, your community or your work? And I'm going to be strict. You've got a minute each. So have a think very briefly now. Go anywhere you like with that question, but I think what it means to me is these two things are completely intertwined. And the last time I stood here actually was just before the pandemic, sharing a poem that I'd written about why and how moving matters in the work around suicide prevention and about supporting people who have breathed through suicide. And there's no better example of that for me as to being back here today talking about moving, about poetry, and about how that matters to well-being and supporting people's health. So you've got 2 minutes. Talk to the person next to you. I will call at 1 and you swap over. Go. And change over. And stop. And stop. See, it's really easy, isn't it? So just a quick show of hands. How many people talked about something creative in their conversations? Hands right up if you talked about creative things. How many people talked about things that helped them to move in some way? Hands up. Brilliant. How many talked about something that did both of those things along the way? Brilliant. So there's a relationship between these things, and there's and these things, support and enable each other too. So I'm just going to bring in my sidekick here, Eve Holt, who wrote a poem to help us launch the GM Moving strategy last year in 2021, just post lockdown or semi-lockdown. And hopefully the poem that goes along with this strategy launch video will really help you to see what GM Moving is. So this is where I'm going to start to share a bit of learning. What is GM Moving? How are we working? And how is it relevant to the way that we might deliver this strategy together?
GM Moving is our shared movement for movement, our collective call to enable active lives for all. So we can all move more together, whatever the weather, so we can all move our way, whatever the day. Designing moving in to our places and spaces and increasing the smiles and the sweat on our faces. Putting the joy back in the journey, encouraging play on the way. Making sports more inclusive, removing the barriers, making our facilities fit for purpose for all abilities. Ensuring nothing is done about us without us, and helping each other to move more each day. Throw a stick for the dog, try a slow jog, take a walk as you talk. Fly a kite, take a hike, ride a bike, scooter or trike. Cleaning, gardening, DIY, or find something new and give it a try. Together we can find a way to design moving into everyone's day. So get involved, join in. Share your stories on WhatsApp, Facebook, Snapchat, Instagram or Twitter. What's brought you joy? What's made you fitter? A photo, a post, at home, in the park, provides inspiration, creates a ripple and a spark. Write moving into your policy. Put it on the agenda. It's your business too, whatever you do. Moving helps us to take notice, to give and to learn. Happier, healthier and more connected. Moving brings more benefits than we ever expected. Wherever you live, work and play, there's a way to move a little more every day. We are all GM movers, movers and shakers. It's who we are and it's what we do.
So thanks, Eve. Eve's just at the front here. I didn't know she was coming. I was petrified when she turned up. She's the creative one in our team, and I just think that really brings to life how this is a movement. It's about all of us. It doesn't matter what our role is in the community or in our job, that we can all contribute to creative health together. And this little short video just really describes, and this touches on quite a few things that people have mentioned already about how you connect and change the system. So again, another little short animation that just describes better than I could in a few words how we work through GM Moving.
Greater Manchester Moving is a social movement designed to help people move more and enjoy a healthier and longer life as a result. If this was a simple problem, it would look like this. In reality, this isn't a simple problem. It's a complex problem. Real lives are unpredictable and influenced by hundreds of different factors. We may feel we have personal choice, but it is very much defined by the world around us. We are tied into a system of influences that expands throughout our friends, family, our workplace, any community groups we are part of, local government, national government, and even our culture. In a complex system, if one thing changes, everything else changes in response. For example, government policy directly affects us all. But it also shifts when enough of us want it to. Constant change means that something that worked well in Didsbury last year might not work in Glodick, or even again in Didsbury, today. To transform a system this big, unpredictable, and messy, where do we even start? This is what we ask ourselves every day at GM Moving. And our answer is everywhere. For a solution to work locally, we need a deep understanding of that area's unique strengths and what can be done. Right here, right now, to get people moving. Decisions need to be made within the community that let local people take the lead on making active lives easier. But those in charge of large institutions also need to be on board, because for local change to happen, it must be supported by high-level strategic decisions. What we do is hard to measure. Rather than how small parts of the system are causing people to change, we want to know how the system is changing as a whole. Every day, Greater Manchester Moving advocates are working with town planners, large employers, and small community groups. Our role is to spark meaningful conversations in lots of places at once, to gently and slowly influence and recruit people at every level to use their own creativity and initiative to transform things for the better. To follow what works, wherever it leads. To share the excitement when something goes right, as well as support people to learn and try again when things go wrong. It will take patience and it will take time. But we believe that by doing things differently and accepting complexity, we can create changes that get real people moving in the real world. We believe in the power of Greater Manchester's people to make positive system change happen. That together we can design moving back into life. If you believe it too and you want to be part of it, visit www.gmmoving.co.uk today.
So hopefully you can see from that it's about what we do together in all the different ways that we do our jobs every day, pointing them in a direction that supports creative health. So it doesn't have to be starting lots of new things. It's about how do we point the system in a direction which supports that creative health and tackling inequalities in the way that we can use and mobilise the resources that we've got in our system. So together we can do this. There are some things that we've learnt help. We've got the benefit of some embedded researchers in the work, have had for the last few years, and there are some things coming out of that which we can share about how important it is to shift all the things in the system, as has been described by the video. And one of the things that we've added to this over the last few years is that outer layer around culture and belief and ideology and narrative that's been mentioned today already, how we change that, as well as changing policy, the physical environment, the way our organisations and institutions operate. So to hold that in mind as a kind of, a model, something that we can use every day in our work, I think would really help in this work as well. The other thing is understanding that we don't need to try and move everybody all at the same time, so we just need to start somewhere. We need to find the catalysts, the spark plugs, the people with the energy for this agenda, and then create the conditions for that ripple effect, that when you get people working together on something and with a shared mission and common purpose, just how brilliant that is and how much that can catalyse energy when people can point themselves in that direction as well. So there's a bit of hope and optimism for you there, and a hope and optimism that we can shift government policy, as said in the previous animation, is that we do together, we can make changes happen that we can't make on our own. So that's worth holding on to as well. The evaluation work that we've been doing has shown us that there are some really common enablers of change, as are shown up here. So we've already seen in this room today strategic leadership that enables collective and distributed leadership. We've seen the desire to learn and adapt. We've seen about effective working across and between sectors, between community and voluntary sector, between health, between local government, etc. And we've heard a lot talked about on the panel about building on strengths, growing assets, and really listening to what matters to people. These things really matter, and when they're not in place, for example, when we know from the commissioning question how governance and processes get in the way of what we're trying to achieve. So again, together we need to work on shifting some of the things that are holding these problems in place. And it does take a different kind of leadership. It takes the kind of leadership you've seen here, where people convene people and people open up conversations and people have a different kind of conversation about the work. And there's no ego in it and there's no lanyards, and it's about something that we're working on together. So there's a whole load of stuff that's coming through our evaluation around what kind of leadership that is and how we need to behave in the work and how we need to support each other to collaborate, not compete. So again, there's information on this on the GM Moving website if you're interested, but it does, I would say, invest in the leadership and the capability from the beginning. And I'll finish there really, but I would just say, to finish off with, it does start with you and me, and it starts with the belief that it matters, and I think we've seen that in spades today. So thanks so much for the invitation to come and share the learning. Loads of people in this room contributing to GM Moving already. The ask is that we all contribute to creative health along the way, so thanks.
Thanks very much, Hayley, and I'm really looking forward to carrying on to work together on delivering both of our strategies and initiatives. Okay, so we're going to move on to our last kind of big thing of the afternoon before we hear from Ella at the end. It's a panel of practitioners. Hebe, do you want to introduce people, or do you want me to do it as people come up? Okay, well, our final panel, if they'd like to come and take the stage, I'll just introduce Hebe. So Hebe Riley is a fairly new director at Cartwheel Arts in Rochdale, and she has been quite instrumental in practitioner voice in the strategy, and she's going to continue to do that. So she runs the Live Well Make Art network, so Cartwheel Arts run that, which is a practitioner network to make sure that we have practitioner voice threaded through this strategy, and we really support practitioners as we develop it and deliver. Okay, thank you.
Brilliant. Thanks so much, and hi everyone. It's such a privilege to be here and such an exciting day. As Julie said, I'm the director of Cartwheel Arts, and we're a participatory arts charity based in Rochdale that work with diverse communities at all stages of life, from early years, refugee and asylum seeker families, up to adults living with dementia, to deliver high quality, inclusive arts projects that celebrate culture and heritage. We also administer the Live Well Make Art network that Julie just mentioned, which is the Creative Health Practitioners Network for Greater Greater Manchester. So if you're interested in finding out more or sharing more of the exciting projects like the ones we're going to hear about today, do pick up a postcard from the welcome desk and sort of get connected to us. So I'll introduce our panellists one by one as we go, and I'm going to go through in the order of kind of stages of life. So I'll start with Dr. Kat Taylor, who is the kind of person to go to on children's mental health and arts in Greater Manchester. She's a clinical psychologist who manages the arts, culture and mental health programme across all 10 boroughs and is really instrumental in linking the different sectors of mental health.
Thank you, Hebe. Hi everyone, hi, I'm Kat. So yeah, I'm a clinical psychologist and I work in CAMS with children, young people and families and lead the GMI Thrive Arts, Culture, Mental Health programme. So that's been running for 3 years and I did wonder how best to use this 5 minutes and I've decided to tell a story. As Sandeep said, you know, it's the most memorable and the best approach. So I'm going to tell my story, mostly about the work that I'm doing now, but then go in reverse about what inspired that story to illustrate the practice really. So for those who don't know, Thrive is the National Transformation of Children's Services, and at the heart of that is about broadening the offer so that mental health expertise and knowledge is kind of spread around the system and not just isolated in specialist mental health services. So currently, only 1 in 3 young people with mental health needs can access our services, and even among those that we do see in CAMS, around 40% don't improve. So clearly we need to change what's available. Added to this situation that a lot of people have touched on today is workforce stress and difficulties with recruitment, retention. So nationally, GMI Thrive is the only team with an arts and culture programme, and we have the work evident here today to thank for that and the context of Arts for Health here in Greater Manchester. As a programme, we seek to share knowledge and practice among the workforce. We deliver training and we kind of work at the levels that Hayley's just outlined really, the different kind of direct right up to strategic level. Next year we're going to see 10 creative health offers across the children's services, so that CAMS teams should all have creative health offers. And crucially, we are collecting the types of evidence that commissioners can use. So the roles of the arts and culture are many in children's services, and young people themselves often highlight stigma and are often gloomy environments. And I think creative health, you know, can address both of these issues. My own concerns as a psychologist around the over-medicalisation of distress and how, you know, young people are being kind of in childhood and adolescence. Many of their problems can be better understood as normal responses to traumatic circumstances or as socially determined. So I see that creative health can offer developmentally appropriate change, and this can be achieved through the playfulness and versatility available in the arts. So can we have situations where we've got artists supporting clinicians in formulation or storytelling? I'm nodding at Jackie, ARC do a lot of this work. And, you know, it's clear that the arts can support some of the major predictors, such as hope, purpose and belonging. So how did I end up in this? So before Thrive, I worked in Finland, who have adopted creative health. They've sort of committed to that. And I worked at Arts for Health with Clive, who we heard from earlier, for about 4 years, and saw how artistic methods can help reduce the use of medication, for example. We worked on a project called Dimension Imagination, where we could see that often arts-led approaches can help reveal the person more, and maybe more fully than more traditional clinical approaches, whilst also being pleasurable for the participant and the provider. And so why did I end up in a School of Art after training as a clinical psychologist? Because that's quite, you know, it was a bit of a risk, it felt like a risk at the time. So during clinical training, again, we've thought about training, that I found that we were quite limited in bringing in creative methods to augment clinical interventions and to be more personalised with our evidence-based work. And so I thought this particularly applies to children and to people who are maybe not neurotypical. And so in my training, I looked at the role of creativity for people living with extremes of mood or bipolar disorder, because these are people who often report benefits of this disorder, or one of which is creativity, but that clinical services didn't really recognise that. And the reason I did that was because when I was 19, I was diagnosed as bipolar and told very solemnly by a psychiatrist that I would need to lower my ambitions. I needed to not be stressed or party. No partying, no stress. Wasn't really my character. It's not really a bipolar character either. And I was really keen on, I was aware of side effects of medication, and I'm not being critical of people who use medication, but I do question how routinely it is prescribed and highlight how difficult it is actually to resist that. And even now, I work with young people who don't want to take medication at the age of 16 or 18, but don't really see any real choice. So for me, and this is to end really, simplistically, music was really key. Learning to play an instrument, putting my focus and my energy into something more constructive. And I think that the outsourcing of solutions in mental health is a bit of a problem, and that Creative Health can equip people with the tools and the experience that you need to navigate your own mental health, which might take all of your adolescence, your young adulthood, or even your whole life. Okay, thank you.
Brilliant. Thank you so much. All right, I'll take us next to Paul Hine, who's the CEO of Made by Mortals, a participatory arts charity and social enterprise in Tameside. They bring people's experiences to life through immersive podcasts, films and music theatre shows, just like the one we saw in the opening. Armchair Adventures is a children's podcast made by older people and has had over 50,000 listens, charted in the top 20 global podcasts for children, and is Virgin Atlantic's in-flight podcast for children, and recently won bronze at the British Podcasting Awards. Hidden, yep. Hidden, which is the project I think we'll hear a bit more about today, uses creativity to challenge people to walk in someone else's shoes. It worked with hundreds of health professionals and underserved communities in the Northwest. It's won the University of Manchester Outstanding Contribution to Public and Patient Involvement in Education Awards, the BBC's Making a Difference Award, and the Royal Society of Public Health Awards for Arts in Health.
Thank you. You'd have thought that I wrote that myself, it was that good, didn't you? So, Creative Health is about health generation through the application of creativity. It's clearly about providing therapeutic benefits to the citizens of Greater Manchester through taking part in participatory arts. But what I want to focus on briefly is that I believe it's also about creating and cultivating communities of creative citizens. That includes artists, that includes health and social care practitioners, commissioners and researchers, and most importantly, diverse groups of underserved people with a broad range of lived experience, coming together to help each other, to support each other, and bring about a shared change that they all want to see. A shared change that will benefit everyone's health and well-being. And for Made by Mortals, we facilitate this through the application of the principles of co-production and participatory arts practice. We look to support people to bring their experience to life so others can take a walk in their shoes. We use this as a vehicle and catalyst for discussion, sharing knowledge and developing understanding. It is also achieved through using person-centred approaches and inspiring person-centred approaches in others. And I feel this strategy sows the seeds necessary for this type of work to take place. It sows the seeds when it talks about creative health, bringing people together to design and deliver services. It sows the seeds when it talks about creative health being a vital tool for prevention and reducing health inequalities. When it quotes the Marmot Review that found that social participation increases healthy life expectancy. What better route to social participation than through the act of creativity? When it quotes Public Health England, explaining that solutions to health inequalities need to be addressed within the context of their root causes and within the wider determinants of health. The participatory arts can help to do that work, and our Hidden programme is an example of that in action. Through that programme, we have developed work through person-centred approaches with diverse groups of people with a broad range of lived experience, including to date over 65s, people that identify as non-binary, people with English as not as their first language, as well as people with lived experience of cancer care, dementia, mental and physical health illness, digital exclusion, poverty, learning disability and domestic abuse. And all these groups of wonderful people are passionate about sharing their lived experience and their creativity for the common good. They work together on equitable footings with world-class artists, health and social care practitioners at the top of their fields to create immersive podcasts, films and music theatre shows. And we've had loads of fun while we've made it. And we've made new friends, and it's improved our own individual health at the same time. And all this work made by all these wonderful people is available for free on our website, madebymortals.org. If you go to the hidden page, click on that, you can listen and watch loads of wonderful stuff. Also, the show that you saw earlier, plug, is available for free to come and see at the Lowry on the 10th of this month on Eventbrite. Search it on there, Hidden Adam Show, and come and see us. But in many ways, this is just the start of the process. Our community then uses that work to bring about change. For example, a group of people with experience of cancer care created audio in partnership with GM user involvement and clinicians to drive more inclusive practice on their pathway boards. A group of young people identifying as non-binary created immersive audio case study that led to staff and volunteers at Tameside Hospital making changes to their approach to gender for local people presenting at the hospital. A group of adults with learning disability or autism created an interactive workshop to inspire their support workers to help fight their corner when it came to physical health and support them to live healthier lives. A group of women with lived experience of domestic abuse have co-created a short film and training resource, working in partnership with adult safeguarding boards in Oldham and now across Greater Manchester to raise awareness and provide person-centred interventions in domestic abuse cases for older adults. That's not fluffy, is it? For us, a person-centred approach is about providing that sliding scale of participation centred around the individual. Different ways, different levels, different times, different formats, in person, online, through resources. Facilitating a process that all stakeholders can invest in and draw out of fairly and openly. A process that treats people as equals and values lived experience, imagination, communication, artistry, alongside more traditional health and social care, knowledge and expertise. For us, we look to inspire person-centred approaches by moving health practitioners to a place of openness and compassion through the arts and providing a space to reflect and connect with real people and really hear the voices and experiences of others. Once the practitioners are in this space, we ask them to make a pledge, and then working with our partners, we hold them accountable to what they have said. So when you think about creative health, and you have a good read of this strategy later on today, I want you to think about creativity as a route to providing wider social participation, as a way of citizens across Greater Manchester from all walks of life, yes, generating health for themselves, but also generating health for others. Thank you.
Brilliant, thank you. Next up, I'll introduce Dawn Prescott, who's the Director of Lime Arts, who we heard before is one of the pioneering arts and health organisations. Established in 1973 and based at Manchester University NHS Foundation Trust, MFT, Lime is an internationally acclaimed arts and health organisation with a diverse portfolio of award-winning projects in hospital and community healthcare settings spanning 49 years. As one of the largest acute trusts in the UK, MFT employs more than 20,000 staff working across 9 hospital sites and in the community, providing care for approximately 75,000 people a year. In autumn 2021, Lime Arts and Wellbeing Centre opened at the Trust's Oxford Road campus, just across the road, and has to date enabled hundreds of NHS staff, including health professionals, students and trainees, to access Lime's pioneering NHS Staff Wellbeing Programme. The centre is the first dedicated and fully equipped artist studio located in a hospital setting in the UK and an impressive resource that presents a global landmark for culture and wellbeing in healthcare at MFT.
Thanks, Evie. Thank you. So I've not prepared a speech. I'm just going to talk about our staff wellbeing programme. I've got a few notes scribbled down here, and I also like to tell the story really of how this all came about. So as Hebe mentioned, Lyme was set up in 1973. I personally have had the pleasure of working with Clive Parkinson, Brian Chapman and Peter Senior, who are regarded the pioneers, and if it wasn't for their inspiration and knowledge and expertise that they shared, I don't think I'd be sat here today. So 20 years I've been working in the arts and health sector, and now here I am as director of Lyme, previously worked as a visual artist and arts and health practitioner. Sometimes feel a little bit sad that I'm not still a visual artist doing the practitioner work, but really working hard to kind of embed the arts at Manchester Foundation Trust. So we deliver a multi-stranded programme. We do built environments projects, we do participatory arts projects, and we have a very active concert and live performance programme as well. But at the ethos of everything that we do, every single project that we deliver, we refer to it as a socially engaged practice, but for me that means we include people in the creative process, and healthcare practitioners, service users, patients, they're all involved in the production of art, whether that's for the built environment to produce therapeutic environments. Within hospitals, a lot of our work primarily now is in hospital settings, or whether that's musicians and artists going into the wards and working at the bedside of patients. So the Staff Wellbeing Project, which I need to talk about, is basically a brand new programme that we set up in response to COVID. So we actually thought we were going to close down when the pandemic broke out because we had to get out of our existing space and move, and we really didn't know what we were going to do. And it was because of the Arts Council emergency funding that we applied for. We got 20k. We quickly shut down all the patient-focused projects for obvious reasons, and we set up an online resource for staff because we were like, we need to support the staff. This is going to be so hard for them, and they're going to need some way of connecting and kind of accessing the arts. So we had an online activity program where we commissioned various artists and delivered printmaking. We posted our packs in the post. We did lots of creative writing sessions that were really popular with staff. Music making, singing, loads and loads of different activities. And that was great, and it went really well, and it was really popular. And as part of that, part of our funding from the Arts Council, we set up an online resource for staff. So we've set up an online membership platform where MFT staff can sign up and become Lyme Arts members. They can connect in an online creative community. They can share their artworks and feel more connected to what is an enormous creative community across the workforce. As Hebe mentioned, we've got over 20,000 staff at the hospital, so that's a large community to engage with all this brilliant arts activity. So soon after, in response to the popularity of the online arts offer, we needed a new space because we were really keen to get back onto the hospital site, and we were really fortunate to get a grant. There was lots of money flying around during the pandemic, and we were really fortunate in terms of supporting NHS staff wellbeing, and we were really fortunate to get a grant from Barclays Bank to refurbish an old gym at the hospital, and we've turned it into a brand new arts and wellbeing centre. And that is a fully facilitated printmaking studio. So as a visual artist and printmaker, I'm very proud to say that we have a dark room, we've got a wet area, we've got the full facility, and we've been doing lots and lots of screen printing recently with lots of staff and directors from the hospitals. The CEO of the MRI was actually in charge of the jet wash in the wet room the other week to clean screens, silk screens, and they loved it. So we're really fortunate to have the centre. We have also in May, we had our first Arts and Wellbeing Festival at the hospital site. So that was a really joyous occasion. We had Indian dance workshops, we had loads of creative activity, we had a symposium where we were really privileged to have Clive Parkinson and Dr. Jawida Ido presenting at that and supporting us. And we will continue to have that Arts and Wellbeing Festival at the hospitals every year from now onwards. We've also got 2 gallery spaces at the hospitals where we are displaying staff artworks. So that's really great as well. So now where we are, we've received... I keep going the funding. We got funding from Barclays. We've now got funding from Boohoo. We're always looking to the charity to see where our next tranche of funding is coming from. And even though we've been delivering this work for so long and it is so embedded within the trust, we still need that support and reassurance that we are going to be able to continue, not on a 12-monthly basis, but a 3-year basis or a 5-year basis. It's really important. So now we've got our Create Plus programme, which is a 6-week workshop programme where we're supporting staff that have been off sick on long-term sick, returning to work with stress and anxiety related illness. And we have a preventary offer as well for staff currently in sick who are really stressed out, burnt out. There's quite a lot of them. And they come to Lyme, the Arts Centre, and they do a 6-week course with our artists. And the centre provides an opportunity for staff to sort of meet in a halfway house, because a lot of staff are very anxious about returning to the site, so we're helping them familiarise with the site, but in a non-clinical setting. We're at the very early stages of this project. We're just about to finish our first 6-week block. It's going really, really well, but by March next year we'll have a full evaluation for this, and we're hoping to demonstrate a significant cost saving for the NHS so that we can continue this work and gain investment from the core funds within the trust to embed this programme as a core service within MFT. So I think I've just got to drop some stats here. So I think since we started in 2020, since we started in 2020, we've delivered over 150 workshops. We've engaged over 1,000 NHS staff in the co-creation of artwork. And through the galleries, the festival and everything combined, we have had an estimated reach of 17,000 in our creative community, healthcare community across MFT. So we continue with we will continue with the staff wellbeing programme, but again, we just need that assurance that we can get the funding in place. And I'm really, really looking forward to being part of the delivery plan for Creative Health and working with Julie and Rebecca and Clive and supporting the delivery and getting some new partners and working more closely with people, because I think it is really important that we all join forces and drive it forward together. So 5 minutes, how long is 5 minutes? I don't know. I have to plug our website, because the reason that I've not prepared a full thing is because we've launched our new website today. It's currently got 8 projects on it, but it's going to have about 800 on it when we've finished, because we've got so many. So that's limeart.org, and you can also visit the staff wellbeing platform as well, the membership platform, via the website. So yeah, that's the programme. Thank you.
Thanks, Dawn. I feel there's so many things I want to jump in and respond to, but I'll keep us moving for the sake of time. To last but not least, Lizzie Hoskin, who's the Head of Community at Manchester Camerata. She's going to tell us a bit more about the orchestra's music therapy-based programme for adults living with dementia called Music in Mind, and their training programme for carers, Music in Mind Remote.
Hi, is this working? Yes, it is now. I'm obviously the only nerd that has done a presentation, so extra SWAT embarrassingly points to me. Anyway, nice to see you all, and what an amazing group of speakers I am ending this panel with. So I'm here, if you do the next slide, please, those favourite words. So for those of you who don't know, Manchester Camerata is an orchestra. It's a registered charity. We will work all over the place: Glastonbury, festivals, fields, opera houses, Stoller Hall, Bridgewater Hall. We also work in schools across the region, helping children to have their voice heard through music. And we also work with people living with dementia and their carers. So in this creative health context, it's about our research-driven 10-year programme which supports carers and people living with dementia through music. So we call it Music in Mind. Yes. Right. I'm not going to do PowerPoint karaoke and read the facts. You can read them. You'll probably get a copy of this winging through the ether at some point. Music in Mind has been developed I think, for the last 10 years, with amazing partnership with the University of Manchester, the incredible Professor John Keady, and the professional and amazing Dr. Robin Dowland, who is sitting here with us today. So 10 years of research. It's embedded in evaluation. It is a music making set of workshops that we give to people living with dementia in residential care homes. Since the pandemic, we've also been training carers to deliver the same music making workshops. That was developed when we couldn't get into care homes themselves. It's all delivered by our team of regulated music therapists and our incredible professional musicians who play in the orchestra as well. Oh yeah, the impact slide. I'm not going to read all the facts and figures on this because I think it's probably, you can read it another time. I just thought I'd talk about something that happened this morning at our music cafe. It's called a music cafe. I didn't want to call it a dementia music cafe because if you've got dementia or if you're caring for someone with dementia, you're sick of hearing the word, you just want normal life. So our music cafe happens every Wednesday, people living with dementia and more importantly their family carers. And today's magic moment, there's one every week, and it sounds really trite, and I don't expect it to happen, but it's all our music making is based on improvisation. So it's not being played at, it's people with dementia actually making music. Somehow, the music, which is all quite fervent drumming, and everyone's like, when's this going to end? We're knackered. Brian, who is a regular, who comes from a care home down the road in Gorton, suddenly started singing "Oh Danny Boy," and everywhere in the Great Nave. I don't know if you've been to the monastery, but it's come and visit us. More on that later. But there was the most incredible silence, and suddenly everyone came together and was listening to Brian singing "Oh Danny Boy," and then I think it turned into a bit of Elvis. It was great. But the most beautiful thing for me was that everyone was listening to Brian, and he had the microphone a bit like me today, but better. And Ron and Anne, who are a couple, he has dementia, she's his carer and wife, and she says it's her most important part of the week to come to this music cafe. Ron loves it, but I think Anne likes it most because it's very isolating for her. She's devoted to Ron, and to see them dancing like teenagers on the dance floor, no one else was really looking, but they were both so connected in the moment. For me, that is, you can have your facts and figures, I know that's what funders want, but it's actually witnessing it happen and I wish you could bottle that. Right, I'll start with my story. So I've got 2 minutes of when we've been training carers in care homes. I put together an audio package of an interview with Jade for you to all listen to, and I'll let Jade do the talking.
We use it at different times of the day with different residents. People become really agitated when the sun begins to set, so around time. Anxious, upset, angry, all different emotions are going on. So using different instruments that you provided have a big impact. We'll use the rattles but quietly, we'll use the bells but gently, and then we'll play music in the background. I've seen a massive change in quite a lot of the residents when we do this activity. We have a lady and she's at a point where she's really emotional. We don't want to put on medication. Obviously that's not something we like to do here, we don't like to do that. So at the moment, we're using music rather than medication. That brings her upbeat, that's distracting her from what's going on in her mind. So that has helped us as well with people's emotions again. We have a gentleman, again with his mood. Before we had challenging behaviour, wouldn't join in, didn't want to know, he'd get the shaker, he'd throw it, he'd get the drum, he'd throw it. But now he's excited as soon as he sees a box. The residents have gained confidence from it. The difference from the start of our Camerata to now, some people that didn't have the ability to hold and shake the shakers now are. People that didn't join in and used to sit and watch, and you'll see that they go for the quieter instruments. Then they'll be banging the drum by the end of it. So it's massive.
So thanks to Jade, our carer that we trained during the pandemic. There she is again. So how do we do all this? We consult, collaborate and create. That's our sort of motto, if you like, for how we listen to what people want. We don't want to parachute in and rescue people and then go out again. We want to listen to what they actually need, which is what we're providing through this music cafe in our schools. But we have to do it with support through these amazing people above us. I'm just going to read this. So we partner with the university, the UK Research and Innovation Council. We've got investment from 4 Greater Manchester boroughs and ICGs, as I believe they're rebranded as, to create simple ways that music can help to improve lives of their communities and to support carers. And we all know that carers are seen as, you know, in some cases, little more than carers, cleaners in care homes. So we're still learning. We're learning from all the different people that we're working with the whole time to develop it. It's not we're coming in and we know what's best. We're listening to carers, we're listening to care homes, we're listening to the residents. And by partnering with all these people, it gives us the opportunity, just like to echo what you say, is that we're all here sort of competing for funding. And while all these things are amazing, we would love to have this long-term investment and belief from places like the NHS. We're lucky to have short-ish term, but it's long-term is where it really matters. So I haven't quite... Thank you. There's Brian. That was Brian. He was singing earlier. Anyway, this wouldn't be a cultural organisation without a plug at the end. The People Make the Place is our intergenerational concert we're doing at Gorton Monastery. There are flyers out there. It's bringing together our participants of our Dementia Music Cafe who've written a song called We've Still Got the Moves. Don't write us off just because we've got dementia. It's being performed by them, Gorton Voice Choir, 3 schools who are learning to sing it in sign language with the School of Sign Language in Blackburn, and also the Hideout Youth Zone. Oh, and there's a steel pan band who are going to be playing Africa by Toto, which I'm probably the most excited about. Anyway, there's flyers here. It's free. It's Thursday, the 17th of November, 5:30 p.m. Gorton. Come and say hello. Thank you very much. Thank you.
Thank you all so much, and there's so much that's come out of that. I'd love to continue that conversation and totally echo that thing about funding and long-term investment for the arts so we can keep doing all this magical, life-changing stuff. I've just been informed by Julie, unfortunately we don't have time for questions, but there is a drinks reception afterwards, so if you've got questions and want to continue the chat, please do reach out to one another and have those conversations. Thank you all so much. It was so interesting. Thank you.
Checking Ella is still. Where's Ella? Where's she gone? I don't know where Ella is. Who's going to be Oh, there she is. Right. Are you almost ready? Okay, right. I'm really conscious of time and I'm really sorry we couldn't take any questions there. We've kind of, as always, lost a little bit of time. But I'm hoping you can stay for some cake and a drink downstairs in the gallery at the bottom of the stairs in a couple of minutes. I'm just going to give some closing words, tell you about what's happening next, and then pass on to Ella, who's going to sum up the afternoon for us. So I wanted to thank everybody who's spoken today. And I want to tell you a little bit about next steps. So the strategy is available online from now at the GM Integrated Care website. It's the first integrated care strategy there has been. But we'll also, yes, thank you very much. So I'm actually really pleased about that. And we will send you a link to the strategy via Eventbrite. Work now begins on our 3-year delivery plan, and that delivery plan will kind of start delivering in April 2023, although make no mistake, we've already started. I've got a meeting tomorrow. This will amplify existing practice and test new responses to health challenges. And our practitioner network, Live Well Make Art, will also be working with us to deliver some co-design events with practitioners across GM. We're also holding some round tables looking at each area of the life course and then very specific clinical pathways. And if you would like to join these conversations or you know someone who does, please get in touch. You can contact me directly through Twitter, you can contact the PCCA team, of which I'm part, on Twitter, or email. There's an email address on the back of the strategy, or just give me a shout. Before you leave today, you might be wondering, what are those little bits of the card? So I wanted to invite, there we are, and that's what they are. I'd like you to fill out those pink and green cards you've been given. The green one is for an action or an offer, and the pink one is for an outstanding question. And you can leave those in the boxes on the registration desk on your way out, or if you want to just leave them on the table, that's fine, we'll come around and get them. So I'd be really, really grateful. We probably will send you out a little event evaluation of like 3 questions, but this is really important for us. Getting an offer or an action, what you feel fired up about, and then also what is it that you still want to know. I need to do some thank yous, almost finally. So I'd like to thank Jeff and the team for the fantastic tech support, enabling us to live stream as well as be here in the room. Obviously to Rebecca for her tireless work to get this strategy over the line and for nagging me incessantly. All our speakers for your really thoughtful and inspiring contributions today. Creative Manchester, who've co-delivered this event with us, and especially Anne-Marie Nunez, who's I think is in the room, for basically doing all of the lead work. Anne-Marie, you've been amazing. Clinical sponsors for this strategy, so Jawida, Muna and Sandeep. And Arts Council England for putting some initial investment into when we started delivering this strategy. And I'm hoping our conversations will continue. My colleagues in the person-centred and community approaches team at NHSGM, and I know when I joined the team, they were like, what do you mean creative health? And I think they're probably heartily sick of me talking about it at the moment, but hopefully today we've created a bit more of a movement around this work and we can really integrate it into the way we work across the whole of health and social care. So that's all I wanted to say. I'm unbelievably pleased and proud to have managed to deliver this strategy in Greater Manchester. And I'm just going to pass you on, before I cry, to Ella, who is going to sum up what she's heard from this afternoon. Thank you very much, Ella.
So I wrote this just from listening to the speakers and taking it all in. So this is a poem for you all. Doesn't have a title yet. Bless the messy nature of human impulse to create. We are deserving of full lives that are rich and free and great. I see it woven in the fabrics of our complicated lives, the threads of colors and the patterns that can teach us to revive. Each day with movement and tenacity, with culture and with art, it proves our worlds are made of intimately interwoven parts. We have the power to replenish and renew our energies. Imagination is the vital tool that builds communities. The very thing that holds us, some might call the social glue, is our deep yearning for connection, the strength of me and you when we use art to frame our voices. We are reaching across lines, we are filling in those gaps, and we are breaking through the confines of the old and broken narratives about the ways we live. We are ready for the radical, bold, brilliant, and big. Thank you.
Ella's going to be sending us a version of that poem, and we'll make sure we send it all out to you, and we'll be putting it out on Twitter and basically everywhere. That's it from us. Thank you so much for coming on quite a windy, blustery, rainy day. Really do encourage you to come downstairs and have a chat if you'd like, to have a drink, have some cake. The conversation is open. Thank you all for coming.